away to all of you, but did not unmute because, you know, this is Zoom and I'm a meme. Thanks everybody for joining us. We're really excited to have our annual meeting and our 10th anniversary meeting. I'm Alyssa Bassler. I'm the CEO of the Illinois Public Health Institute and the Executive Director of the Illinois Alliance to Prevent Obesity. As you join, please be sure to put your name and organization in the chat box so we can see who's with us today. And if your name isn't on your picture on your Zoom, if you can change the name on Zoom too, if that's possible, that'd be great. So everybody can see who's talking when we're talking and who's on the Zoom. We're really excited to celebrate our 10 years of the Illinois Alliance to Prevent Obesity with all of you. You've all been great partners who've helped us to shape the coalition and keep it going throughout these 10 years. If you haven't been with us for 10 years, just as a reminder about sort of our history, in 2010, the Illinois Public Health Institute looked around and saw that there were quite a few organizations working on obesity, nutrition, physical activity policy. And we pulled everybody together. We had some available resources. We pulled about 30 organizations together who were working on this and said, should we have a coalition that works on policy? There's a tobacco coalition, there is an asthma coalition. Do we need an obesity prevention coalition? And the answer was really yes. Everybody was very excited about it. So we formed IAPO, and we took about a year to get stakeholder input through regional meetings across the state to devise our very first obesity action roadmap. And of course, that gave us also an opportunity to connect with folks all around the state who were, interested in this and start to build our statewide structure. So while the coalition structures changed over all of these years, we're still a dedicated group of organizations and advocates with a shared purpose. Our mission now, as we define it, is to work for equitable and just opportunities for Illinoisans to eat healthy and be physically active to optimize their health and well-being. And we do it through various different ways, including partnerships and collaboration, public awareness building, technical assistance and advocacy. We also develop, change, and implement policies and systems to support nutrition and physical activity and eliminate social and institutional barriers to maintaining a healthy weight. And we foster communities and institutions that integrate healthy foods and beverages and physical activity choices into everyday activities. We've continued to focus on key policy issues that have been identified by our work groups and coalition members over the last several years and have an excellent leadership council or committee that helps to steer the way. We have quite a few funders, and I'm just going to take a minute to thank them all over 10 years, just as quickly as I can. But it's really important to recognize those organizations that have invested in this policy work and in this collaboration and coalition work. As you know, that's not always the easiest thing to raise funds for. So we want to thank especially first Blue Cross Blue Shield of Illinois, who gave us funding very back at the beginning that really helped us launch the coalition and get it off the ground. We've also had funding for many years on and off from the Chicago Community Trust. They've been one of our longest time funders, as well as the American Heart Association Voices for Healthy Kids Initiative, which is a joint initiative of the Heart Association and Robert Wood Johnson Foundation. The Illinois Department of Public Health, Cook County Department of Public Health, and the Consortium to Lower Obesity in Chicago Children included us in various federal funding streams and cooperative agreements around these topics. We had funding from the National Network of Public Health Institutes, the Arnold Foundation and Action Now Initiative, Action for Healthy Foods, the American Diabetes Association, the American Cancer Society, the Association of State and Territorial Health Officials, CBS Echo Media, the Illinois State Board of Education, the Pew Charitable Trusts, and the UIC Institute for Health Research and Policy. Those all gave us funding for specific and special initiatives that let us advance particular parts of our agenda. And finally, a big thanks now to the Centers for Disease Control and Prevention, which is supporting our current work with the Illinois State Physical Activity and Nutrition Program, or ISPAN, with a cooperative agreement of $4.6 million and over 5 years to improve nutrition and physical activity throughout the state, and also through the Chicago Cares Initiative to work on preventing diabetes in Chicago. I also want to take just a second to thank the IAPO staff, who you all know and who've been in contact with you on and off over the last few weeks for this meeting, and then over many years have been really the backbone of all of this work, and none of it would have happened without these folks. So just want to thank Jana Simon, Sarah Chuzid, Catherine Bernstein, and Pasang Ganrong for all of their dedication and hard work. Today, we're going to look back at our work from the past 10 years, share our successes, and lift up lessons learned that may help others on this journey to collective impact. We'll focus on our coalition's journey on 2 key topic areas: sugary drinks and physical education, as told by our many coalition leaders and partners. We'll have some opportunities for engagement throughout, but not specific time for Q&A for each of the presenters. If you have questions or comments, please feel free to drop them in the chat box, and we'll try to address them as we go. Please also be sure to join us again tomorrow from 1 to 3 to help us look into the future for the IAPO as well. And finally, we're excited to share a video of some of our partners celebrating 10 years of IAPO. And here it is. I think Sarah is going to share that with us now.
Yep, just one sec. Let me get this up. One moment. Okay.
Here's to 10 years, IAPO.
Starting back in 2010 with regional meetings that collected input from all parts of the state on how we could control obesity and increase the health for everyone in Illinois. And it's continued through today, seeking input and connecting local organizations to a broader statewide coalition.
It's critical that organizations and agencies focus on forward in policy, particularly as it relates to health equity.
For me, what's the most remarkable is that IAPO brought together the clinical, the public health, and community to really look at the condition, the disease of obesity.
Congratulate IAPO for the effort it has been doing for so many years related to prevent obesity, particularly in the minority community, in the Hispanic community, and the African American community.
Members of the Illinois Alliance to Prevent Obesity have been strong partners over the years, helping to implement CDC federal grants that were administered by the Illinois Department of Public Health. And we want to thank all of the partners for their commitment to this work.
Over the years, the Healthy Southern Illinois Delta Network has partnered with IAPO to create policy systems and environmental change in Southern Illinois. We've worked together to create baby-friendly hospitals, improve the built environment, and much more.
Thank you, IAPO and all its partners, for building the campaign around sugar-sweetened beverages and supporting the Illinois chapter American Academy of Pediatrics to secure pediatric health care for overweight and obesity as a covered Medicaid benefit.
Peoria City County Health Department and our regional partners applaud the Illinois Alliance to Prevent Obesity in supporting partnerships and initiatives like iSpan that have played a role in helping us implement policies and interventions for healthy living in the Peoria area.
Through webinars, workshops, task forces, and meetings, the importance of health, nutrition, and physical activity and PE, my passion, has been communicated to students, parents, teachers, administrators, and legislators. Let's continue the work and pump up PE for the next 10.
My name is Tony. I was a part of the Breastfeeding Community Advisory Board. I would like to say that the experience was very fun. I felt heard. I felt like all of my issues were addressed, and I am very confident that in the future, people will not have to face the same issues that I faced, and that people like me, that look like me, faced as well.
Illinois Stewardship Alliance has been a partner in the Illinois Alliance to Prevent Obesity, IAPO, for the last 5 years, and that partnership has been really key in advancing policy that addresses the root issues in food and health. Thanks to the Coalition's collective effort, this year we passed a new statewide fund, the Healthy Local Food Incentives Fund, that will give farmers markets the ability to match SNAP dollars spent at their markets.
And so I just want to congratulate you. It's been supportive of my work as well as others to bring people together across the state to think more about how to improve health in communities.
It's been the Illinois Public Health Institute's great honor to work with all of our partners to support IAPO for all of these years. Thanks to everyone who's worked with us.
We want to congratulate IAPO on reaching this milestone.
Congratulations, IAPO, on 10 amazing years.
Thank you, IAPO.
Oh, thank you. And that was really great to watch. Thanks to everyone who contributed to our video. Hi, everyone. I'm Jana Simon, a program director here at the Illinois Public Health Institute. And so we wanted to highlight today 10 highlights from the last 10 years. We want to take a look back at what our coalition's done together and in no particular order, highlight things that we think we'd really like to celebrate. So first, we couldn't have had a coalition for 10 years without all of our partners and the infrastructure we've built together, from the steering committee and the leadership council to all of the work group members who have participated over the years, to the hundreds of volunteers who have helped move policy and program initiatives forward. The partners for this work are definitely the #1 highlight. Second, we want to take a look back at some work in 2014, the Ounce of Prevention Fund, which is now Start Early, the Consortium of Lower Obesity in Chicago Children, or CLOC, and several members of the Health Subcommittee of the Early Learning Council helped to propose and implement sweeping changes to the licensing standards for child care centers in Illinois. These changes help to ensure that infants receive daily tummy time, screen time that's limited in facilities, sugary drinks were eliminated and juice was limited, and there was always space available for breastfeeding on site and much more. And while it's been 6 years and we're still working to advocate for the licensing standards to be updated for family and group homes, this work was really driven by a lot of IAPO partners. And the CDC recently released a state report card on how state licensing standards are meeting best practices. And we saw that Illinois jumped from meeting only 19% of the best practices in 2010 to over 50% of the best practices in 2019. And that is thanks to all of the partners who make up IAPO and have worked on this issue for years. So it's definitely a highlight to share. #3 is the Rethink Your Drink campaign. And while we're going to talk more about this in a little bit, we really wanted to share that in 2014, IAPO's Nutrition and Communities Work Group developed and launched a Rethink Your Drink toolkit to help promote education about the health harms of sugary drinks in communities across Illinois. From spreading facts like that sugary drinks are the #1 source of added sugar in the American diet, to providing tips for how to encourage healthier options, the Rethink Your Drink toolkit was used by over 150 organizations, including local health departments, schools, community-based nonprofits, YMCAs, universities, and more. And the campaign developed posters, infographics, social media campaigns, and taste testing events all around the state to start to change the culture around sugary drink consumption. And it's definitely a highlight to celebrate. #4, and again, we'll go more into this in a little bit, but our sugary drink tax campaigns really became a crux of what we've been known for in the policy world. And this is the hard work the coalition put into the Healthy Eating and Active Living Act at the state level and the Cook County Sweetened Beverage Tax in Cook County to raise needed revenues through a penny per ounce tax on sweetened drinks. And while the HEAL Act was our main focus from 2014 to 2017, and we built support from legislative and executive leaders across the state, we also helped to move public opinion for such a tax to fund wellness and disease prevention in our state. And IAPO played a central role in supporting the Cook County Sweetened Beverage Tax as well. And while we'll learn more about this journey later, we wanted to highlight how well our coalition has mobilized and worked together on really tough policy issues. The next highlight is some of the local food summits that have really shaped our current work. So one of the IAPO work groups that was focused on improving the local food system to increase access to fresh fruits and vegetables and healthy foods, improve the local economy, and support environmental sustainability. In 2013, IAPO partners helped to convene the Healthy Farms, Healthy People Symposium to consider research and policy barriers and opportunities for strengthening the local food system. And in 2018, a food summit that focused on food and economic development was hosted, featuring many IAPO partners as experts. These food system summits helped to shape a research report exploring the economic and health impacts of local food procurement, built our expertise to promote the adoption of food service guidelines and other changes to procurement and food environments, and help sustain our advocacy to promote the Healthy Local Food Incentives Fund. Which brings us to number 6, the Healthy Local Food Incentives Fund. In 2016, IAPO advocated to pass the Healthy Local Food Incentives Fund in Illinois, which supports farmers markets across the state to offer double value coupon programs for people using the Supplemental Nutrition Assistance Program, or SNAP. So essentially, a SNAP participant can swipe their link card for $10 at a market and get $20 worth of fresh produce from that market. And while some markets had sources of local funding for these programs, as a matter of equity, IAPO partners wanted to create a statewide fund to support the programs in all areas of the state and for all communities that needed them. And in 2016, the Healthy Local Food Incentives Fund was passed into law, albeit with some caveats put in place by then Governor Rauner and through a mandatory veto. The fund was set at $500,000 and was a pilot program that was going to expire in 2019. So in 2018, we updated the law and made it a permanent program. And we finally, in 2020, as part of the state budget, passed a few days into the towards the end of the legislative session, the very limited session due to COVID, a $500,000 appropriation was in fact made into the fund this year. This has been a huge bipartisan success to support low-income families' access to affordable and healthy fruits and vegetables. And you can see from the quote here, it's really impactful in communities. Number 7, we wanted to highlight the Healthy and Active Communities Network. So this was looking back at the creation of the Healthy and Active Communities Network in 2012. We call it HACN for short. As part of an initiative by an IPHI fellow from the Centers for Disease Control and Prevention, the Healthy and Active Communities Network brought together local health and community coalitions that had been funded by the We Choose Health initiative that was part of the Illinois Department of Public Health, and through the Healthy Communities Coalition funded through the YUSA and Illinois State Alliance of YMCAs. This network provided capacity building, technical assistance, and peer sharing across the state, and greatly improved IAPO's ability to connect to local level issues across our state. And HACN helped to implement the on-the-ground policy and program work that's so critical to improving nutrition and physical activity. And while we'll also talk about number 8 further on in today's schedule, we couldn't exclude it from our top 10 highlights. From supporting a statewide task force to updating learning standards to advocating for improvements to the statewide requirement for the amount of physical education provided to Illinois children, the IAPO Childhood Nutrition and Physical Activity and Education Work Group's journey to enhance PE has included countless partners, policy work, education and professional development, and a huge amount of coalition collaboration to implement our vision to improve the health of children across the state. And it's definitely one of our top 10. Number 9, working on Medicaid coverage. We have worked to promote Medicaid coverage of 2 key programs related to obesity. First, in 2013, IAPO partners, led by the Illinois chapter, American Academy of Pediatrics, helped to ensure that the Illinois Department of Healthcare and Family Services clarified its policy around coverage for obesity counseling for pediatric patients. A provider notice was sent out to clarify that coverage was available for pediatric counseling even without a comorbid condition. And this improved access to this critical counseling for families across the state. And second, and something we continue today, is that the IAPO Clinical Access and Community Linkages Work Group helped to launch the work to advocate for Medicaid coverage of the National Diabetes Prevention Program and Diabetes Self-Management Education and Support Services in Illinois. While this advocacy continues, great progress has been made to raise awareness of these important lifestyle change programs to preventing and managing diabetes and the need to improve access to them for all low-income Illinoisans. And last but not least, number 10, because of the partnerships, infrastructure, and expertise we've built together over the last 10 years, the Illinois Public Health Institute was awarded 2 5-year cooperative agreements from the Centers for Disease Control and Prevention to expand and sustain many of the strategies that were in the IAPO roadmap. IPHI received $4.6 million over 5 years to implement the Illinois State Physical Activity and Nutrition Program, which focuses on improving breastfeeding support and continuity of care, integrating nutrition and physical activity into early care and education systems, promoting physical activity through changes to the built environment, and promoting the adoption of food service guidelines in institutions across the state. The CDC also funded IPHI to launch the Chicago Collaboration to Advance Reach, Equity, and Systems, or Chicago CARES, to prevent diabetes, And this $6 million grant over 5 years helps to expand the National Diabetes Prevention Program in Chicago, as well as develop and innovative solutions to recruiting and retaining low-income and high-risk individuals into the program. We couldn't be doing the work today without all of our partners and the work of IAPO from the past 10 years. And so thank you for taking a look back at our top highlights with me, and thank you for being part of this journey. So we would like to go ahead and dig a little bit deeper into the journeys around 2 specific campaigns. First, our journey to address sugary drinks and promote the adoption of sugary drink taxes to fund wellness and prevention. And second, our journey to promote enhanced physical education in Illinois. So we're going to provide a quick summary of our work told by our partners, highlighting the context and research behind our policy campaigns, the key policy and advocacy components, perspectives on how the coalition and working across sectors and partners improved our work, and any lessons learned for future campaigns. So we will ask you to engage along the way, and we hope you enjoy remembering these stories and reflecting on our lessons learned. So before we get started with sugary drinks, we want to go ahead and take a poll of our audience and figure out how you all have engaged in this work in the past 10 years. So Sarah, I think will launch the poll, or maybe Pasang. So please tell us, how have you participated in the IAPO work around sugary drinks? You can pick at least one. I'll take a minute for everyone to log their choices. Almost everyone's voted. All right, we'll go ahead and end the poll and share it. All right, so almost a third of you have used the Rethink Your Drink toolkit. About a quarter of you did some HEAL Act advocacy, 20% some Cook County advocacy, and surprisingly, 40% of the folks on this call have not participated, which means this has now been several years since we really had this as a big part of our campaign. So thank you for answering that. I think it's really interesting. All right, so to help us set the stage, we are going to kick us off with our partner, Amanda Kelly at the American Heart Association, and go ahead and take it away. And again, this will be sort of a story told quickly by all of our partners, so we hope you enjoy following along. Go ahead, Amanda.
Hi, everyone. As Jana said, it was quite the journey, and it was fun to kind of look back at old files and find the process as how we got ourselves here today. So super high level as we look through this, in 2010, 2011, when we continued to see this rise in obesity and the work that was going on, and as more and more research and studies were coming together, and they were pointing out how added sugar was a key contributor to this epidemic. And of course, through that process, what was learned is that the largest source of added calories in the American diet was connected to sugar-sweetened beverages. So that is going beyond just full sodas. It is looking at our Gatorades, our sports drinks, things of that nature, juices that aren't 100% juice, things of that nature. So how can we raise some awareness and look at these pieces? We started seeing some successes in other places when people looking at this information. So we know Mexico had passed a policy in 2014 around taxing beverages within their space. Berkeley had just started passing as things picked up here in Illinois. So I know you'll hear more about that piece later, but what was important for us is seeing the growing evidence and the growing science within the space that if we wanted to try and attempt to turn the tide on obesity, tackling sugar-sweetened beverages is an important part of that. Next slide. So again, where did we start in this policy? It was really around increasing awareness. So how do we educate the public and educate those individuals who have the opportunity to create change within their spaces about tackling this issue to help us curb this? So to Jana's point earlier, the Rethink Your Drink toolkit had been created, an opportunity for people to be trained on this issue, educated. We built up a speakers bureau of folks that were comfortable talking about this work and talking about these facts, so we could go out and train our churches, our healthcare centers, our corporations, our park districts, all of these other great places where people were going to consume beverages, and giving the opportunity for us to help create that change. And we did this through the sense of, when you're working towards any big, broad public policy change, you start small. So, us bringing it to our partners within the healthcare space was a good, an opportunity for us to have an effect. You know, hospitals are places where you go to get healthy. So let's make sure that those are places that are also offering healthy options to those that are staying and those that are coming to visit. I know Anne's going to share a little more detail on what that looked like and how it came to life within her space. But we also looked at, you know, vending opportunities. How can we create healthy change within a vending space? So, you know, partnering with the Chicago Housing Authority and some of these other locations on creating healthy vending within their spaces. What that led us to this space and where we went from there, resources that were developed. Voices for Healthy Kids created toolkits and model policy for folks to be able to utilize. AHA put together a food and beverage toolkit with policy guidance. I know we worked with some around IAPO as well, but really pulling in those key partners is what helped lead us to a success in the beginning space of educating our partners. And you can go on next to Anne.
Good afternoon, everyone. My name's Ann Marchetti, and I've had the privilege of running the DuPage County Obesity Prevention Initiative called DuPage Forward. Next slide. I want to share with you briefly what my theme of this is, and that is you're only as good as your partners when you're doing coalition building work. Forward actually started in 2008 before IAPO, and we almost immediately had our health systems at the table. They agreed that this was an important issue, but getting them engaged deeply was difficult. We had a meeting with all of the health systems in 2010, and they agreed that any work that they were going to do with us had to be turnkey, it had to be strategic, it had to be results oriented, it had to be an extension of their existing work, and it had to bring some recognition for the health systems. So we asked them to commit to a multi-year plan. And then for the next 2 years, they were at the table with us, but not on anything specific. Next slide. And then came along the work that IAPO was doing. I believe it was through some Robert Wood Johnson funding in partnership with the American Heart Association and Healthcare Without Harm. And I unfortunately missed the research summit, but caught the newspaper article on Vanguard Health System going sugar sweetened beverage free. And it was that ammunition that I needed that I sent to all of my health systems in DuPage County, asking them if we could come together around this important issue. So IAPO and our partners, really American Heart, Heather Gravis, and Dr. Donald Lloyd-Jones, Alyssa, your work with Terry Johnson, Healthcare Without Harm, and Gary Cohen, and Scott Steiner at Vanguard were really critical to these first steps that we took in 2012. Next slide. So what we did in DuPage County over the course of the next 6 years is worked with a total of 9 health systems. And as you all know, there were lots of mergers and acquisitions during that period of time. But those 9 health systems made a commitment to work on their food and beverage environments. And it was through the help and support of the Illinois Alliance to Prevent Obesity and their partners, our partners, American Heart, Healthcare Without Harm, the CDC, that we then were armed with a plethora of tools that allowed us to go in and work with these healthcare systems, provide them some small grants, and use these very helpful tools and assessments for them to understand where they are and where they could go. So the sugar sweetened beverage tax, the Rethink Your Drink campaign, the sodium reduction efforts of the Heart Association, the HEAL Act grants, all helped us work in partnership with our health systems. And I'm telling you that because that's the power of our partnerships. Through that, over the course of 7 years, we had tremendous success in all of the health systems. Next slide. And what we're going to show you next is a very brief slide into some of the results that one of the health systems, it was Cadence Health, now Northwestern Medicine, what they went through. They were the last health system to come on board, and really having not only the leaders within the hospital get up and take notice, but having the right groundswell from the committees below, as well as leadership at the top, is what helped them to get there, and all of other hospitals. Go ahead, Sarah.
Great. Just one moment while I get the video going.
And as you're teeing this up, again, the health system was so proud of the work that they did is they put together a video that would really explain the kinds of changes that took place as a result of this collaborative effort.
Chronic disease among the healthcare profession, ironically.
Here we are in a hospital setting, helping care and cure for the sick, and yet sometimes we engage in behaviors that may not, in fact, be supporting that very mission. So we've got some work to do, and we're committed to supporting that effort.
We're going to encourage people not to indulge in sugar-loaded beverages. We're going to encourage people to bring more fruits and vegetables into their diet.
It's about balance. How much you choose, how often you choose, and what you choose, all of those things combined.
There's food, beverage, movement, and lifestyle components to this campaign. We started this informal running group about a year ago. It's one resource to help grasp and embrace healthier lifestyle. It's a means of establishing nutritional guidelines and boundaries because we do keep each other accountable. We see that as tying in directly to relationship-based care.
Our goal really is to bring a population-level perspective to healthcare, both looking at the individual patient, but really looking at communities and populations of patients.
Communities look for us to give them guidance on what will best influence their health and well-being.
The intent here is not to remove every single unhealthy item throughout our food and beverage environments.
It's not our place to tell you what to eat or how often you exercise. That's not what this is about. This is really about making the healthy choice the easiest choice, and I think that people will embrace it.
So in closing, I just want to thank the Illinois Alliance to Prevent Obesity, Alyssa, your leadership, and all of the staff, all of the community partners. Without you, we would not be where we are locally in DuPage County, and I look forward to the next 10 years.
Great, thank you, Ann. And next up, Julie Myerstar from the Heart Association. Go ahead, Julie.
Great, thanks so much, Jana. Thanks for having me today. And I just want to echo Ann's sentiments and say thank you for everyone that's on the call for what your organizations have done over the last 10 years. And thank you to IPHI and the staff for really leading the charge. I know we're on a little bit of a tight timeline, so I'm going to try and do this quickly, but there's so much information to share. So the first thing I want to mention is really actually about the end goal. So I'm going to talk about two things, the Healthy Eating and Active Living Act, as well as the Cook County Sugar Sweetened Beverage Tax. Two completely different campaigns, but very much intertwined as the same journey towards the same goal. So we're going to start with the HEAL Act, which was the statewide effort to reduce, I should say it was a multi-year statewide effort to reduce consumption of sugary beverages while also reinvesting in the state and the community. So I've outlined a couple of sort of high-level things here, and I'm going to dive into a couple things that were, I think, of the utmost importance for this particular campaign. So first and foremost, like I said, several year-long campaign, and the time frame is important to note because, as was mentioned earlier, this actually overlapped with some of the sugary drink work that was going on in other parts of the country at the same time. So we saw some momentum build. We saw some places pass sugary drink taxes. And we saw this really, the awareness rise to a different level across the country. At the same time, for the policy piece of it, this was during the former administration, during Governor Rauner's administration. I'm sure many of you remember the extreme financial situation that the state was under when there was a 2 to 3 year, depending on how you look at it, budget, a time frame where we had no budget. So the budgetary issues created a huge hole for the state's finances. So this was, again, a comprehensive strategy to not only address sugary drink consumption, but also fund Medicaid and the Wellness Fund, reinvesting back in our communities. Important to note that the HEAL Act was a penny per ounce tax on just sugary beverages. And those of you that were involved in Cook County know where I'm going with this. So again, it was just sugary beverages, milk, water, and 100% juice, as well as diet beverages, artificially sweetened beverages were exempt from the tax. Excuse me. The revenue that was projected was going to go to fund Medicaid, which would plug a huge budget hole that, again, I mentioned the state was suffering from. While at the same time, a portion was going to go to fund the wellness fund for chronic disease prevention. And I think that multifaceted approach was really helpful in garnering support with the public, with coalition members, and with the legislature. This broad coalition support was 70 plus across the state. Actually, I think we had more than that, but that was the number I felt safe putting there. And led to, I think, an increased awareness in the legislature that actually at one point had the sugary drink tax, the HEAL Act, in the version of the Senate bill. I think the overall takeaway from this campaign was that it really laid the groundwork for work that was going on at the time and where we were going to move in the future. And if we can go to the next slide, please. So again, going into the sugary drink tax campaign in Cook County, this came several years into the HEAL Act. And again, we laid some of that groundwork. So this wasn't by any means a new initiative or a new idea, but the way it was brought to the health advocates and those of us that had been working on the HEAL Act was a little bit different. I mentioned that the HEAL Act was a really multifaceted, comprehensive strategy that the advocates in this group right here really put together to address a number of different things, to look at the problem and then come up with a solution. So this tax idea was out there. And then in September of 2016, Cook County President Tony Preckwinkle came to some of us and said, this is a great idea. Let's move forward with this. Not knowing at the time, I don't think, had we known, it might have been a little bit different, that the intent was to pass this in 2 months during their budgeting period. So again, completely different approach to the county campaign as opposed to the statewide campaign. We had 2 months to prepare for this. Probably the biggest difference in the actual policy proposals, and many of you are aware of this, was that the Cook County proposal included artificially sweetened beverages as part of the package that would be taxed. That immediately affected the type of support we were getting, the organizations that could be involved, and the messaging, really, the overall messaging. So, those of us that were able to sign on, I think immediately had to get to work. We had to mobilize, and we were successful. And again, thanks to many of the partners on this call, in putting together a full campaign strategy. And all of the things that you'll see listed there, plus many, many more, because again, at the time, we didn't realize this campaign would last about 1.5 years. So I want to talk a little bit about some of the barriers that we faced. One was the very well-funded Can the Tax Coalition, which is a very organized group of those that are against the tax, again, including, you'll see the Beverage Association, both the Illinois and American Beverage Association, the grocers, the Teamsters at a time were opposed. So we had the unions that were against it to a certain aspect, the retail merchants and others that came out and formed this coalition that, again, was very well funded against the work we were doing. The time frame, again, going back to that, because I think it's so important when we're looking at the overall, the bigger picture. The tax was set to go into effect on July 1st, 2017. As suspected, a lawsuit was filed delaying implementation. So the tax was really only effective from August 2nd. The county did come out on top of the lawsuit, but it delayed the implementation. So the tax was effective from August 2nd. It was then repealed, and the Cook County commissioners in October of 2017. And then it was last effective on December 1st. So we saw a very small time frame in which to gather data and evidence of the tax and the effects it was having. A couple of other limitations was the taxing authority from the county. This was supposed to be an excise tax, but because of, not to go into too many details, but because of the structure of the county tax system, this tax ended up having to be administered at the register and show up on the receipt, which then affected how and on whom the tax was imposed. There was a lot of back and forth, folks may remember, about whether SNAP recipients would or would not be taxed. And this made it so they, it went back and forth a number of times, but having it on the receipt and administered at the register made it appear as a sales tax. The other key difference, I think, in this this particular Cook County proposal was that there was not a dedicated, the revenue was not dedicated as it was in the HEAL Act. And that was for a number of reasons, but that enabled the opposition to claim this as just another tax you have to pay, and that the county was attempting a money grab. And that was really the messaging that they landed on, that I think ultimately helps to overturn the ordinance, was that this was just another tax, and that the county's trying to, you know, again, pull off a money grab. So at the end of the day, you know, many more aspects to it, but at the end of the day, I think the takeaway from all of this is that because of the work that went into, like I said, this longer, years-long journey, and because of the level at which this campaign went to, you'll notice that I did put a link in the bottom of this slide. That is a UIC study that was just released in February of this year, showing that the tax itself and the campaign surrounding it did have a positive health on cutting consumption and boosting healthcare funds, even for the limited amount of time that it was effective. So I would always hate for people to think that this work, I think people hear about the campaign and it was repealed, but I can, from personal experience and from the study, tell you that people definitely do rethink their drink. And I will leave it there.
Thank you, Julie. And next we have Robert Schultz, who's now currently with the Active Transportation Alliance, but during the time was an organizer with the Illinois Public Health Institute on this campaign. So Robert, I'll turn it over to you.
Thank you, Jenna and Julia. I am Robert Schultz III. I'm currently at Active Trans, Transportation Justice Advocacy Organization. I joined the Illinois Public Health Institute team working on two aspects of the sugary drink tax, creating political support among Cook County commissioners to pass or to support the tax, to retain it, and the Rethink Your Drink public education campaign. As mentioned before, both activities occurred concurrently. The goal throughout was to keep the message focused on the health benefits that would accrue because of the tax, encouraging behaviors, changes in purchasing behavior. However, balancing the health benefit and the tax message was the challenge of doing this work. In the end, the health message was overwhelmed. To build support among Cook County commissioners, the grassroots organizing put an emphasis on public education with print media, leave behinds for organizations that had engaged constituencies, such as faith communities, survivor groups such as breast cancer, and neighborhood organizations. Throughout, opportunities were sought both to expand the coalition, mobilize people and groups to contact their county commissioners to express support for the tax. There was a strong presence to support the tax the day to reconsider the tax vote occurred. The Rethink Your Drink promotion was the public education effort regarding the harms of sugary beverages and to promote healthy alternatives. We tabled at community events, distributing print materials that explained rethinking sugary drinks and the health benefits. There was even a heavily promoted social media campaign with ideas for engaging in sugar-free beverage tastings and activities for families. Thank you very much. Now it's Alyssa.
Oh, great. Thank you. Sorry, let me just find my notes here. Thanks so much, Robert. It was such a great campaign, and and a lot of effort. As Julie said, there was a lot going for us and a lot going against us. And I think one of the important things was sort of the lessons that we learned and the takeaways from that process, and how we, think about trying to apply some of them to new initiatives. So when we, look back at the ups and downs of all of these campaigns, we focused on the Rethink Your Drink education. The national and local culture around sugary drinks began to change. Our expertise in sugary drink research and best practices for addressing the harmful impacts grew, and that work helped us build support for the HEAL Act, which helped us become the experts that Cook County leadership reached out to for guidance. Work on the campaigns often snowballed, and expertise begets opportunities, which builds expertise. So, things start small, and they add up to more over time. We also learned that having an established partnership was key to allowing us to mobilize quickly around policy that came up suddenly. In many efforts, building and sustaining relationships allows for greater flexibility for responding to immediate threats and opportunities, including both policy and funding for the work. And I think, the 10 years that IAPO has been around, and the many relationships that are sort of built within that will serve us well as we continue, and have served us well in many initiatives as we continue to try to advance a just and equitable nutrition and physical activity policy and culture in Illinois. Having a clear policy bottom line is also really critical in helping coalitions make decisions quickly. By understanding what policy best practice was related to sugary drink taxes, we were able to quickly decide where to cross the line for support or not to support for specific policies as they arose. We'd recommend that all policy coalitions set clear criteria for acceptable policy. And what we learned during both the HEAL Act and Cook County campaigns was that clear, consistent messages from all partners was key. And I think you heard that we felt like the message about health was really, and the message about where the money was going were really critical components in Cook County, and they got a little bit lost, and that we think had something to do with why eventually the tax was repealed. Because the focus was, it's just another tax, it's not about health, and that was able to sort of turn people away from it. The public can get easily confused with multiple messages focusing on different things, and we learned just how critical it was to have a message about how the money would be spent in the state sugary drink tax campaign. Knowing that the revenues would be used for initiatives people cared about made a big difference in their level of support. And finally, as was seen in Cook County sugary sweetened beverage tax, involving and organizing the community around a specific policy after it has been fully formulated is too late and may perpetuate inequities and implementation challenges. Had Cook County done more work to engage and mobilize communities for months or years before trying to pass the tax, they may have seen a different outcome. So we'll take these lessons learned for future campaigns, and we hope you find them useful for your work as well. So I think I'm turning it back over to Jana.
Thank you. And actually, before the physical activity break, we just go back to the last slide. We did want to have everyone take a moment and just reflect if you were involved in the campaign, one of the challenges or lessons learned that you took from it, and if you were not involved in the campaign, listening to today's thing, something that you really took from this presentation. So if everyone could take a minute and type into the chat box a challenge or a lesson learned that you think you've learned from or can take with you into the future, we'd love to hear about it. And so we'll go ahead and pop that in the chat box. And you'll see from the next slide that got popped up already, then we'll have a one minute physical activity break just to stretch our legs and stand up for minutes before we sit back down and continue. So I will look, anyone have anything to share in the chat box of things that you learned or want to take with you? Never underestimate the opposition. Politics within counties can be difficult. Yeah, anything else to share or reflect on? Still surprised at the amount of public backlash. Yes, so people can really get mobilized quickly. Consistent messaging is important. No matter what you believe your opponent's arguments may be, you will never really know what they are. Be flexible. Yep. Collaboration is key. Great. Thank you everyone for sharing. Politics can eat advocacy for breakfast. That's great. More engagement with community around developing the message is important. Yes. Great. Well, thank you, everyone. Please take 1 minute to go ahead and stand up and stretch. We'll reconvene and get started in 1 minute here, but please, I will go ahead and do the same and stand up for just a moment. Thank you. All right, my trusty timer just went off after a minute, so we will go ahead and reconvene. Thank you, everyone, for stretching. So our next story, to round out the rest of this celebration meeting, is really to look at our journey around enhancing physical education. So similar to how we just did sugary drinks, we will go ahead and share our journey with enhancing physical education and ask for a little bit of your engagement along the way before we wrap up later today. So to set the stage, we have Rosa Romero-Richter from Healthy Schools Campaign, Director of Chicago Programs and Policy. So Rosa, I'll go ahead and let you take it away.
Great, thanks so much, Jenna. Hi, everyone. I'm excited to present this section. So on our next slide, I just want to say, we are very thankful for IAPO's leadership and, moving forward and moving the needle of physical education in the state of Illinois and beyond. We've been a partner and for many years now and have worked with school districts across Illinois, but specifically with Chicago Public Schools to increase healthy school environments. But I'll first start off by saying what we all, intrinsically know, that healthy students are better learners, and physical education is a key way that we can develop and raise healthy, active children while also providing the safe and supervised, structured environment that our children need to learn and practice physical activity behaviors. And as you know, it's also a key way to achieve the recommended 60 minutes of daily physical activity. And we believe that schools are so important in order for achieving these goals. But for too many students, including those in Illinois and across the country, PE doesn't exist. The majority of states do have basic requirements for PE and for those that teach physical education classes. But at the same time, many of those states allow waivers, exemptions, undermining those requirements. And compounding that problem is also just the systemic racism that is inherent in the way that we fund public schools, which makes resources, resources limited and also makes it difficult for schools that might be dealing with a lot of other issues to really prioritize the health of their students. So for us, and and for many of you, I know that quality physical education is important, not only for everyone, but also our most vulnerable students, our low-income students and communities of color that have also been compounded in the way that health disparities have impacted them. So schools really can provide opportunities for movement to all students. And, PE is also an important strategy to help, really narrow those disparities in education, but also in health. And I'll explain a little bit of that as we go on the next slide. So first off is, physical education's impact on student health. You know, research has documented the positive impact on a student's physical, mental, and emotional health. We know that it's linked to better bone health, muscular fitness, a healthy body weight, and it's also really developing those skills for a lifetime where they can practice behaviors and prevent chronic diseases such as heart disease, cancer, type 2, you name it. In addition to that, we know that being active supports children's mental and emotional well-being. I think that 1 minute physical activity break for us, you know, is just a great moment to reset and refocus. And so we know that works in the school environment as well. But also in addition to that, physical education really provides that space for children to learn how to make decisions, learn how to cooperate, how to, you know, resolve conflicts, and, you know, but also be much more goal oriented, and have greater social interaction among their peers. Next slide. And, you know, finally, like their impact on student learning, you know, there's just been an explosion of growth in the body of evidence between physical activity and the structure of the functioning brain. And so time spent in physical activity is, you know, strongly related to how the cognitive development and the health of the brain is for the long term. So in a school setting, active and fit children, they consistently outperform more of their inactive, unfit counterparts academically in both the short term and in the long term. Children also demonstrate a higher scholastic achievement, but also better classroom behavior, greater ability to focus. They experience less absenteeism compared to their peers. So overall, I think, you know, it's physical education has a positive relationship with academic achievement. The CDC did a huge study that really looked at all the different studies impacting the amount of students spend in PE, and, you know, overall found that it has a positive relationship, or there's no relationship that shows that it negatively impacts academic achievement. So with that, you know, there's so much in this field, but those are the few nuggets that I wanted to share to really set the landscape of the importance of physical education in our school buildings. Thank you.
Great. And next up will be me, Sarah Chusett from IPHI, to talk a little bit about the history of our journey as coalition. So Illinois has long been a leader in valuing children's health. For decades, the state had a daily PE requirement for students in grades K through 12. And more on the origin of enhanced PE in Illinois. So in 2011, at the invitation of the National Network of Public Health Institutes, NNPHI, and the Association of State and Territorial Health Officials, ASTO, the Illinois Public Health Institute, the Illinois Department of Public Health, and the Illinois State Board of Education attended an event with the CDC to review the Community Guide to Preventative Services. You can see it there on the left, the cover, a picture of the cover. And they reviewed the guide and a series of evidence-based interventions that are shown to help with chronic disease. And they were there to select one to try and implement in Illinois. So after reading about these and the data behind why physical fitness is important to reducing the risk of chronic disease, the group chose enhanced physical education. Enhanced PE entails maximizing the amount of physical activity and movement time and intensity in school-based physical education class, PE class. So this delegation came back to Illinois and then led the development of an enhanced PE strategic plan, the second picture, for Illinois. And advocacy for that plan by IPHI and our IAPO school health advocates led to the passage of two laws. The first law established a task force that was charged with updating and revising the state learning standards on physical development and health, and also to develop a plan to promote enhanced PE in Illinois. The revisions that were made to the state learning standards, and Deb Vogel from IAPO here on the call, one of our major PE partners, led the element of the task force that was charged with revising these standards. So these changes, these revisions integrated enhanced PE concepts, such as focusing on health and fitness, cooperation, and the building of lifelong skills instead of just focusing on sports and competition. These new standards were adopted in 2014 and went into effect in the 2015-16 school year. So the second law, which was an outgrowth of a recommendation by that first task force, required fitness assessments for all K through 12 public school students, and also the reporting of those fitness scores to the state. Also, this law established another task force, which made recommendations on how to operationalize this fitness testing and the reporting process. IPHI and other members of IAPO served on both of these task forces, and this fitness testing went into effect in the 2016-17 school year. Finally, further advocacy by Healthy Schools campaign led to the addition of the average number of days of physical education that are provided per student every week on the Illinois school report card. So based on this experience, IPHI was then selected by the Cook County Department of Public Health as part of a CDC grant to develop and deliver Pump Up PE, Promote Health, Learning, and Lifelong Fitness, which is a professional development program for PE teachers on implementing enhanced PE in the classroom. Subsequently, the IDPH also funded Pump Up PE trainings outside of Cook County where it started, and IPHI was also commissioned privately by many districts to provide these trainings all across the state. As part of all this, IPHI trained a cadre of trainers that in total, up to this point, delivered over 50 trainings to over 1,000 PE teachers from over 300 districts across Illinois. This training program was independently evaluated by CLOC and was found to produce statistically significant increases in the knowledge and capacity of teachers to implement enhanced PE policies, as well as statistically significant increases in physical activity levels in PE classes for teachers that were sent to this training. And then lastly, recognizing a continued need for recognizing a continued need for professional development for PE teachers, IPHI and IAPO partners developed many webinars on different aspects of enhanced PE. You can see some examples here on the slide. And now finally, we also recognize that the ongoing education of school leadership and policymakers is essential. There's always turnover. It's never-ending work. So as such, in 2018, with funding from Voices for Healthy Kids, IPHI was able to engage a professional communications firm to develop new PE messaging and materials. You can see some of this new core messaging on the right. Also with funding for Voices, we were able to develop and host a workshop for PE leaders, school leaders, highlighting a series of case studies on ways Illinois schools and districts were able to implement enhanced PE and best practices and create comprehensive health supporting environments. As part of this work, we compiled a set of testimonials about the importance of PE from teachers, students, parents, and school leaders. We were also able to create a webinar version of this workshop, and we're currently turning this content into a series of online modules as part of NNPHI's Springboard to Active Schools initiative. Now I'm going to turn it over to Deb Vogel from IAPO.
Good afternoon, everybody. I'm going to focus what I'm going to be saying on what lessons we've learned, because I think we've learned a lot of lessons. The first lesson that I thought about when we talked about being a coalition is that sometimes you need legislation to move forward and a network across the state in order to support and speak to legislators and others across the state so that we have a voice in many places. With that, I think one of the things that we tend to have and work on having a clear and consistent message when we start talking to legislators or school boards or whoever else that we need to talk to. This comes up a lot with when we talk about our standards journey. And it was a journey because we thought we were just going to be able to do that, just revise the standards. And we were told by ISBE that no, we couldn't, even though other people did. So that's why we ended up with legislation to be able to do that. And that became very important. And when we started talking in terms of the fitness testing, I think that we became a very important voice for students and teachers who were going to be in the implementation part of this, because we made sure that kids understood that they own their own fitness, and therefore their fitness scores were not going to be used to grade them because they own it. Also, we didn't allow it within this legislation. There was a piece that said that educators, their scores that their students had couldn't be used in their evaluations. And some people say, well, that's not good. Well, it is. It's very good in terms of not everybody has the same facilities. Not all the students have the same opportunities. And some of what we talk about in fitness testing is genetic. We're happy to have been that voice. Last thing I want to say is that learn, no matter how hard you work to get an outcome, it may not be in your hands. And that came to fruition when we lost the daily mandate. Even though legislators told us that, if it was standalone, we would have passed and kept that mandate. But because it was tied to and became a pawn in the budget, the year that we didn't have budgets for 2 years, that we lost that mandate. But we also learned that it set the stage for our next steps in advocacy, and part of that we'll talk about tomorrow. Next up will be Diamond Ross.
Hello, everyone. Here's a little bit today. I be here today to recap a little bit about the work done in my previous role, working with school health to support schools in implementing enhanced PE, which helps to get kids moving during the day. The Cook County Department of Public Health collaborated with partners, including IPHI, to offer professional development opportunities, training, and customized support to schools of the Healthy Hotspot Initiative. This was done between 2015 and 2017 with the Partnerships to Improve Community grant. Collectively, efforts help to raise awareness of the importance of physical education, physical activity, and enhance the quality of physical education programs.
Diamond, we're having a little hard time here. It's a little choppy for us.
Can you hear me now?
Yes.
Okay, I'll start again.
Thank you.
All right, so to support schools in implementing enhanced PE, which helps get kids moving more during the school day, the Cook County Department of Public Health collaborated with partners, including IPHI, to offer professional development opportunities, trainings, and customized support to schools as part of the Healthy Hotspot Initiative. This was done between 2015 and 2017 with CDC funds during the Partnerships to Improve Community Health grant. Collectively, efforts help to raise awareness of the importance of physical activity in schools and enhance the quality of physical education programs across suburban Cook County. As part of the initiative, a total of 25 pump-up PE trainings organized by IPHI were held and trained about 515 physical educators representing 156 school districts. Attendees gained practical strategies, tools, and resources to align the curriculum with state learning standards. Administered fitness tests in Illinois beginning the 2016-2017 academic year, increased students' level of physical activity with modified games and classroom management procedures, as well as champion PE and wellness efforts. A total of 109 PE supply kits were distributed to schools located in priority communities. These supplies were provided in kind by CBS News to support schools with the implementation of enhanced PE. IPHI and IAPO received additional funding to expand the Pump Up PE training statewide. In 2017, funding from IDPH supported delivery of 11 trainings in Illinois, reaching an additional 373 physical educators. IPHI continues to market Pump Up PE trainings and technical assistance sessions statewide, providing various packets to adapt to school budgets and schedules. Thank you.
Thank you, Diamond. And to close us out for this journey is Dale Brown from Illinois State University. Dale, go ahead and take it away.
The place they say you're not supposed to be, right? The speaker right before lunch or the speaker at the end of the day. So I too would like to thank IAPO and IPHI for the opportunity to be involved in the initiatives that have taken place over the years. It's been great ever since we participated on the conference calls that we've had since the enhanced PE bill. Seemed like we were always looking for data or information to be used that could help teachers in justifying and supporting physical education. Sarah, if you want to go to that next slide, please. And so when we were on those calls, we quickly would find ourselves turning to data that would be gathered from California studies or from data from Texas studies. And we realized quickly we didn't have our own data, which basically led to the initiative to write the physical fitness testing bill. And it was just interesting. And I share this picture just from our experiences when we were down together testifying. Seems like but not too long ago, but it's been a while now. Waiting to testify in support of the physical education testing bill in front of the Elementary and Secondary Education Committee. And the superintendent from one of the schools down in the Southern Illinois area was trying to get support for waivers from physical education for athletes. And as we were sitting there waiting to testify for our bill, we realized very quickly when you start to see the comments that some of the legislators were making to argue against the waivers that our job was going to be easy, relatively easy to gather support for the physical education testing bill because clearly they got it. They understood it. Sarah, if you want to advance the slides. And as my colleague Dan and I were sitting there waiting, we could see that they understood. But we quickly learned that while there was support for physical education, there was going to be a lot of work to do with getting that message out for enhanced PE and also for the physical fitness testing bill. So we knew that teachers were being asked to teach physical education in classes that were growing in size from 20 to 30 to 40 to 50 kids. And then on top of that, not only were they being asked to teach physical education and make it meaningful and engage kids in activity, but they were kind of subtly being asked to solve the overweight and obesity problems, mental health issues, prevent diabetes, heart disease, and realized very quickly, for at least for us, for me at the university, that there's things we need to do to help enhance the development of teachers if they're being asked to do more and more, and working with colleagues in physical education here at Illinois State University and exercise sciences to help provide those skill sets that can allow for the implementation of that enhanced PE and physical fitness testing. We also learned very quickly the need for training on implementation of the legislative changes, those fitness assessments. A lot of the teachers, depending on where we were interacting with or where the teachers were from, we're still working off of the old sports skill-based presidential fitness challenge testing rather than FitnessGram, which was more of a health fitness-based assessment. And we often hear teachers saying they didn't like those assessments. They didn't feel like they were challenging the kids. And so we spent quite a bit of time trying to educate them to get them to understand that it's not about sports skills anymore. It's about achieving a fitness score that reflects a healthy aspect to what one's seeing, whether it's looking at cardiovascular fitness, strength, or whatever the case might be. And so as a result of that, as you've seen from slides that have been presented by other speakers, the necessity for Pump Up PE, various webinars, workshops, teacher trainings to help teachers develop the skill sets to understand, some of the impacts that were trying to be achieved with the legislative changes and various initiatives that were taking place. So website support and a variety of avenues to try to provide assistance and help physical education teachers. And another big thing we continue to find when we talk about the fitness testing bill was that But like with any mandate, people kind of scratch their head, and teachers kind of scratched their head and said, what's the state going to do with this data anyway? And we would hear that at state conferences and at teacher trainings, that they felt like this data was just going to be fitness data that was going to be sent to Illinois Department of Public Health and go into some black hole. So we've spent a lot of time trying to get teachers to understand that the goal of this is, I think as Deb said, is to get the teachers to get the data back to the students, because it's the students' data, it's the students' fitness scores, it's their information that they need to have in developing student portfolios and wellness plans, because they need to carry that forward into the real world, because it's certainly going to be important for them as they make their way into adulthood and start looking at the need for insurance and medical care and those type things. And then additionally off of that is really working to connect the physical to the physiological, that it's not just about getting kids physically active, but it's about the physical education, adding education to the physical side of it. And then equally important is connecting the physical with the physiological, that the reason we're trying to do these engage kids in physical education, as Rosa said, is trying to impact osteoporosis and heart disease and diabetes and obesity, and trying to reverse comorbidities. We got a project going on here at Illinois State University. We're finding about 40% of students are freshmen and sophomores are showing with at least one comorbidity for metabolic syndrome, which, you know, it's not what we want to see as they make their way into adulthood. And if you're following anything with COVID-19, I don't know who can't at this point, it's everywhere for us, but you look at the comorbidities associated with COVID, and clearly what we do in physical education has a direct relationship to minimizing the consequences of COVID-19 by helping to reduce obesity and overweightness and diabetes and cardiovascular disease and a number of those comorbidities. So it's been great to see the tremendous gains we've made, that have been made in physical education. And it's great to know that we are poised to continue that progress into the future, given IAPO and IPHI, the partners and the partnerships that exist. Thank you.
Great, thank you, Dale. And I think, you know, what's striking to me about our PE work is really the continuum we've played from policy through implementation. And now I think looking ahead, we'll hear more tomorrow about accountability. And this is one of those areas where we've really, as a coalition, worked on every piece of that, from passing the policy, implementing the policy from a executive and regulation point of view, to getting down to the ground implementation. So we really thank all of our partners in the childhood work group who've worked on this policy journey with us in PE, and we'll have, continue our work, and there's lots still to do, as you mentioned, Dale. So thank you everyone for that. We do want to hear again quickly from anyone who's been part of the PE campaign, your own reflections on some of the challenges or lessons learned from PE, as well as if you haven't been involved and just heard it today, things that you learned from this presentation. So if everyone could take a minute to type that in, that would be great. Challenges: the lack of understanding of the current PE regulation and around what constitutes actual PE. What is PE? Having it not be viewed as an extra, but as a necessity. COVID's impact on PE. And for those of you following along in the chat box, one of your colleagues, Sarah, had asked a question about the impact COVID is having on kids' health, physical activity, nutrition. And I know many of you are probably out there researching it. I know we've sent some research links recently from Jackie Lanier and others who are looking at this, and there are lots of national things. So if anyone has more to add to Sarah, that's something we can definitely continue to monitor. What's the impact of financial resources on PE? Lessons learned: strong sponsors and champions. We have, but they're really important, and they really can take this to their committees and to their colleagues in Springfield. Anything else from anyone? Alrighty. Well, I think to wrap us up, Pasang is going to share some of what we heard in your registration, and I will close out the very end. So I'll turn it over to Pasang.
Thanks, Jana. So during registration, we asked you to please describe your experience with IAPO in 1 to 3 words. We put those responses into a word cloud, which you can see right now. And as you can see, the main words were collaborative, partnership, informative, empowering, supportive, and I feel like those really mirror everything that was shared today. And then to wrap up day one, we have one last engagement activity. So if you can type into the chat box, what motivates you to continue this work to promote nutrition and physical activity? What motivates you to keep going for the next 10+ years?
And only one word.
Yep, so I see equity, community, children, responsibility, partnerships, health, yep, equity again. And I think we all agree, prosperity. Yeah, and I think we all agree with all of these words: responsibility, hope, need. And we're excited to continue this work and keep on going for the next 10+ years.
Great, thank you, Basang. So that brings us to talking about tomorrow. Today was day one, really looking back at how we've worked as a coalition. And tomorrow we're going to look ahead. So from 1 o'clock to 3 o'clock tomorrow, we hope you join us back. We will look ahead to the spring legislative session for policy perspective. We'll look at what the state physical activity and nutrition program has in store for the next 3 years. And then towards the second half of the call tomorrow, we are going to break into regional breakout sessions to really talk about the impact of the current context. We know this world and this coalition have changed a lot. The world is very different right now than it was 10 years ago when we started. And so tomorrow we will really explore the impact COVID-19 is having, the renewed focus on racial equity, the recent election results, anything that is impacting your current work and context. We really want to explore that tomorrow. So join us again tomorrow. Invite some more of your colleagues. There's still time to register. People can still register for tomorrow, and we can drop them into the regional breakout sessions. And we'll have a really great discussion to think about what's ahead and what the opportunities are, as well as the challenges that we all have to face together. So again, thank you to everyone. Thank you to Alyssa for being our fearless leader for all these years. Thank you for all of the partners for joining us. And we will talk to you all tomorrow. So have a good rest of your evening. Bye, everyone.
Thanks, everyone, for coming, and looking forward to seeing you tomorrow.